Okay, so we're talking about your lower leg right now. It's composed of two bones, your tibia, which is this big guy, and your fibula. Your fibula is just, it's not weight bearing, it's just a point for muscle attachment. So it's really not going to have a lot of meat to it. First thing we're going to do is figure out left or right, okay? And so the way that I like to do that is this big flat top up here is going to be proximal. Right? Along the front edge of that, it's called the anterior crest. It's a really sharp ridge. It's your shin bone, right? So you can feel this part of your tibia. It comes out. It's fairly angular. We always hit it on stuff. Yeah, that's hard, but that's going to be anterior. This structure right here is called the medial malleolus. Malleolus is just like a little hammer, a mallet. Right? So it's this little projection that sticks off and forms a little house around your ankle bones. Right? So that medial malleolus, you feel that big bump. We also wonk that on stuff too. It's really that's not part of your ankle per se. It's part of this tibia, this medial malleolus. So as you might guess, that faces medial, anterior crest face anterior. So I know that this is a left tibia and fibula. All right. So, and again, we also that makes this fibula is going to be lateral. Right. It's the lateral bone in the in the lower leg. Just a couple structures you need to be aware of. You have a medial and lateral condyle. Right. Condyle is a little knuckle, a little bump, usually an area of articulation. Right here, we're talking about generally our knee joint. Right here is the tibial tuberosity. A tuberosity, again, is a rough patch. It's going to be a lot of things originate or insert on tuberosities. And so when we talk about muscles, we'll get into what specific muscles attach here. All right, so already talked about the anterior crest, already talked about the medial malleolus. On the fibula, we're not really going to worry too much right now about figuring out left or right fibulas. It takes a little bit of a hands-on experience to kind of get an idea of how these bones connect to each other. This is the two structures you need to be aware of. The head is going to be more proximal. Right, so we have a proximal head for the fibula, and then down here is the lateral malleolus. You kind of look at it, it's a little bit more spade-like. It's pretty general, but you can kind of figure out with a little practice which one is a left and right fibula. All right, and so that's it for the tibia and fibula.